Chemotherapy is an important part of treatment for many patients with non-lung mesothelioma, as it can help shrink tumors and slow the spread of cancer cells. However, chemotherapy works by attacking rapidly dividing cells throughout the body, which can lead to some unpleasant side effects. The specific side effects a patient experiences will depend on the exact chemotherapy drugs used, the dosage, and the individual patient. In general, the common side effects of chemotherapy for non-lung mesothelioma include fatigue. Fatigue is one of the most common side effects reported by patients receiving chemotherapy. It can range from mild tiredness to exhaustion that limits the patient's ability to do daily activities. Fatigue often occurs suddenly and may last long after treatment ends. Managing fatigue through rest, proper nutrition, and low-impact activity is important. Nausea and vomiting. Nausea and vomiting are also very common side effects, especially with treatments given intravenously or through injection. However, today's anti-nausea medications have greatly reduced this risk compared to chemotherapy in the past. Patients may still experience some nausea, especially right after treatment. Staying well hydrated and eating smaller, more frequent meals can help reduce nausea risks. Hair loss. Chemotherapy can cause hair loss by damaging the cells that produce hair growth. Hair loss usually occurs 2 to 3 weeks after treatment begins and is usually temporary, with hair regrowing once treatment is stopped. Not all chemotherapy causes hair loss, and some patients may only experience thinning hair rather than complete baldness. Low blood cell counts. Chemotherapy often decreases blood cell production in the bone marrow temporarily. This can lead to low red blood cell counts, anemia, low white blood cell counts, increasing infection risk, and low platelet counts, increasing bruising, bleeding risk. Blood cell counts are closely monitored during chemotherapy, so additional treatments or medications can be given if needed. Mouth sores, also known as mucositis, sores or ulcers may develop in the mouth and throat during chemotherapy due to inflammation and cell death. This can cause pain with eating, drinking, and increase the risk of infection. Good oral hygiene and mouth rinses can help prevent sores. Diarrhea. Some chemotherapy drugs increase the risk of diarrhea by damaging healthy cells in the gastrointestinal tract. Diarrhea during chemotherapy may warrant anti-diarrheal medication. Staying well hydrated is important. Hand-foot syndrome. Certain chemotherapy drugs can cause redness, swelling, numbness, and even blisters on the palms of the hands and soles of the feet. This reaction, known as hand-foot syndrome, may limit mobility and cause pain or discomfort. Loss of appetite, nausea, taste changes, and gastrointestinal issues from chemotherapy can decrease appetite and lead to unwanted weight loss. Eating small, frequent meals and choosing high-calorie, high-protein options may help offset appetite changes. Fatigue, nausea, hair loss, and low blood counts tend to be short-term side effects that end once treatment stops. However, long-term side effects from chemotherapy for mesothelioma are also possible. These can include heart damage, kidney damage, nerve damage, neuropathy, fertility issues, hormonal changes, secondary cancers, cognitive changes, memory problems, and in rare cases organ failure. Close monitoring by doctors is important. Patients receiving mesothelioma chemotherapy also face risks of infection due to low white blood cell counts. Signs such as fever, body aches, or chills need prompt medical evaluation during treatment. Doctors may advise limiting contact with sick people and avoiding raw, undercooked foods to prevent illness. Medications are available to boost white blood cell counts during chemotherapy as well. Chemotherapy is an important treatment option for many mesothelioma patients, but it does carry risks of various side effects due to damaging healthy cells. However, with today's supportive medications, most side effects are manageable. Knowledge, monitoring, preventive care, and open communication between patients and their healthcare team are key to safely completing chemotherapy treatment and maximizing quality of life. Understanding both benefits and risks of therapy empowers patients through their mesothelioma care journey.